Okay, so infection. This is going to be in 1 of 6, at least, of your diabetic foot ulcers, okay? If you get infected, that is when things really go south, obviously. The normal healing process is very stepwise. You have acute inflammation, which is normal and good. You get cell proliferation, or more and more cells form that help with the healing and the remodeling. You get migration of different macrophages and white blood cells in to take out the debris and to bring in goodness. You get angiogenesis, or formation of new blood cells. You get matrix deposition. Remember I told you about the importance of the extracellular membrane, so important to everything. And then you get remodeling of tissue. That's normal. Well, unfortunately in diabetes, none of that really happens in a normal way, and it's not coordinated, and things are just completely dysfunctional, particularly macrophages. So macrophages are the white blood cells that come in and chew up bad stuff, take it out, but they also signal to the rest of the body, what do we need to fix this area? In diabetes, the macrophages are converted to a type that's mostly chronically inflamed. So it's this constant chronic inflammation cycle. One of the advanced care wound products that we use for this is an amniotic type tissue, and you put it on these wounds and it converts these chronically inflamed, damaging macrophage phenotypes or types of cells to the better cells that promote more natural healing. And that affects directly the extracellular matrix and the immune process. So all of this needs to be thought about, and obviously the infection needs to be treated with the appropriate antibiotics, appropriate surgical debridement and offloading, things like that. Sugar control, of course. So, if you have a diabetic foot ulcer, you have dysregulated immune cells or immunity. Your immune system's kaplooey. You knew that. You have tissue necrosis or death. You get hyperproliferative callus. So you get these big buildups of callus and big toenails, and things are healing and growing abundantly everywhere that you don't need it, right? So it's dysfunctional tissue growth. You get excessive inflammation and excessive chronic low-grade inflammation. You get what are called matrix metalloproteinases. These are enzymes that come in and chew up good stuff. So this is what damages cartilage in arthritis, what damages tendons and tendonitis, things like that. You get more of these in a diabetic wound. And then of course there's a hypoxic environment because there's less oxygen, because there's less blood flow. And then there's delays in growing new blood cells because there's less angiogenesis. All of this contributes to the lack of the ability of a diabetic to heal a wound, which is where we come in.